Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about imaging and the radiation exposure that comes with imaging. Now, there was a lot of hubbub in 2009 when a study was released finding that CT scans, because of the radiation, likely led to some 29,000 cancers per year. There was a lot of, there's been some changes through them, always looking at if you look at a CT scan report, it always say it was done at the minimum needed exposure. But, so since 2009, the use of CT scan has gone up. I will tell you that we see it all the time in patients, especially if you go to the ER, if there's been trauma, you're going to get usually multiple CT scans, and if you're having something with contrast, that's 2 CT scans. The amount of radiation we're exposing people to is just staggering, and we don't seem to be getting better with that. There's a couple of reasons, probably because CT scan is faster. So if you're claustrophobic, that might work well. Also, from a financial standpoint, if you can do them faster, like in the ER, you're going to make more money by doing CT scans versus MRIs. Rarely do CT scans give you information that MRIs cannot. Maybe if it's quick, like if somebody's got head trauma and we want to rule out a epidural hematoma that we need an answer quickly, or possibly in a stroke patient, we need to look at whether there's a bleed or an ischemia, or sometimes with bone, because CT is generally better at imaging bone. For a lot of things, MRI is as good or better, especially spinal stuff. It's almost always going to be better getting an MRI, and yet CT scans are ordered all the time when MRI could have been done just as easily and without any radiation exposure. So it brings us to this study. So we're looking at, 14, 15 years later, and this was looking at a study looking at MRIs or CT scans done in 2023, so again 14 years later, and this time using some modeling and looking at people who had cancer and the amount of CT scans that they had. They estimated that 100,000 new cancers every year come from the radiation exposure with CT scans. And the thing that always gets me is cancer patients who have routine CT scans. I still don't understand that one, because we can almost always get the same information from MRI than we can from CT scans. So it doesn't make any sense to give a known cancer risk factor to people with cancer. And we're not talking one, they're talking about a linear course of CT scans. So instead of that, looking at doing MRIs, potentially ultrasound, depending upon the area, not doing imaging unless medically necessary. I tell you how many times patients go to the ER and have imaging done when just asking a couple of the right questions would have saved the imaging report. So again, these are theoretical constructs. They looked at people who had cancer and whether or not they had CT scans, and used the idea that different radiation exposures with different scans, all of that. So the fact that the estimates have gotten higher over the years is suggesting that this isn't just, they're not just making it up, that the data certainly makes sense. It's only gotten stronger than it did 14 years ago, and just a concern. So if doctor tells you need a CT scan, always question. If they tell you need a CT scan with contrast, question it twice, because that's twice the amount of radiation that you're going to be exposed to. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.